You will never succeed. Why? Because the hospital is the most expensive point of care within the continuum of care. And so you have to move to a situation where you manage these patients from the physician's clinic. Because in the physician's clinic, the physician can proactively engage with the patients and help counsel them to change their lifestyles. Changing of lifestyles might lead to preemption of disease states that lead to situations like hospitalization. So we chose to focus on that physician clinic, outpatient ambulatory setting as it's called in the US, when we decided to build our business in sync with this transformation from reactive hospital-centric medicine to proactive physician-led and patient-centric medicine. Now that physician market in the US is really about a $1.5 trillion market. So about 30% of the $4.8 trillion is reimbursed in the physician clinic. And when we were getting started, that was a highly cottage industry, entrepreneurial industry, where 65% of the 900,000 physicians in America existed in groups of 5 or less. So highly fragmented, cottage entrepreneurial industry. But what we saw coming was a massive wave of structural secular consolidation in the physician market. By that I mean there would be 3 manifests of consolidation. One, large hospitals and health systems that have big balance sheets would start to buy the physician clinics and employ the doctors. Why would they do that? Because in the end, if you have to go to a hospital, which hospital do you go to? You go to the hospital that your doctor refers you to. So in order to get the downstream referrals, the hospital system started buying the physician practices and employing the doctors. Second, when you have a $1.5 trillion industry growing at 7.5%, 2.5%, 3%, a lot of private equity money finds its way into that industry. And private equity came into the physician market and started consolidating them. And that created very large physician corporations, multi-billion-dollar physician corporations funded by private equity. Some of them went public over a period of time. So as this structural consolidation would manifest itself in that $1.5 trillion physician market, we realized that what would happen as a consequence of that, when any industry goes from what I call a entrepreneurial cottage industry to an enterprise scale industrial grade industry, one of the transformations that naturally happens is what I call this rediscovery of the core versus chore equation within the task continuum of the industry. The smart enterprises, they figure out what are some of the core tasks in which they should focus all their energies. That's why they create the most differentiated value. And a lot of the chores that are important but might not be where they create differentiated value, that can do those chores better, cheaper, faster at scale. That will take these chore tasks from these large physician enterprises to do them better, cheaper, faster at scale. So that was the first step of that journey back in